Hello, and thank you for joining this fourth session on incorporating the concepts of a quality assurance performance improvement program in the Peck HPDP program. I am Sarah Leake, a quality improvement advisor from Mountain Pacific Quality Health, and have the pleasure of presenting this session on planning for performance improvement. In session 2, my colleague Sharon discussed using gap analysis in healthcare. Gap analysis involves the comparison of actual performance with potential or desired performance. She explored why and when you would perform a gap analysis and walked through 4 steps in the process. Performance or quality improvement process is used once you have identified gaps and have a specific mission to dig deeper into a problem area. Performance improvement projects are used to plan, implement, measure, monitor, and document changes using a structured process and tools. During a performance improvement project, a facility will identify and implement some changes that are expected to result in improvement. Then you check whether these actions simply support the current process or whether they make a difference and a lasting improvement. By using performance improvement projects, the focus is on topics that are meaningful and address the needs of stakeholders, such as patients, community, and/or staff. We are going to review and adopt a tool widely used in healthcare for the formal implementation of performance improvement activity. The model for improvement was developed by associates in process improvement and adopted by the Institute for Healthcare Improvement as a tool for quality improvement. There are 2 parts to the model for improvement: the questioning or thinking of setting aims, establishing measures, and selecting changes, and then doing by testing the change through plan, do, study, act. The PDSA cycle, Plan, Do, Study, Act, guides the test of a change to determine if the change is an improvement. The approach reminds us that improvement is not about having the perfect solution, but rather it is about trying things out. This session, we are focusing on the first part of this model, and it asks 3 fundamental questions. What are we trying to accomplish? What are we aiming for? How will we know a change is an improvement? Data is information, and data is fundamental to improvement and is especially helpful in answering this question. What can we change that will result in improvement? This helps to determine the changes you will test. Begin with developing a problem statement which is tied to information from the gap analysis and identifying a particular gap that you would like to fix. This is the beginning of planning your process improvement project. Remember the 9 dimensions for quality that we reviewed in session 3? Consider aligning your project with at least one of these dimensions of quality identified for Peck HPDP. Safe, effective, patient-centered, timely, efficient, equitable, program structural, facility-based, and traditional tribal values. These can act as a guide for understanding the relevance and addressing quality. So the problem statement is, the current situation is leading to some undesirable event. Now that you have identified a problem to address, you can develop an aim statement. This is an example template to use to set your aim statement. It leads you through questions that should result in a strong goal, which at minimum should identify the target population, the desired improvement, and the targeted time frame. In session 2, the SMART framework was addressed, which is used to create a goal that is carefully planned, clear, and trackable. As a reminder, SMART is an acronym that stands for specific, measurable, achievable, relevant, and time-based. Measurement is a critical part of testing and implementing changes. Measures tell a team whether the changes they are making actually lead to improvement. So, how will you know that a change is an improvement? Measurement over time is essential to quality improvement and should be collected as frequently as possible or as often or as useful for this test of change for the project. Measures are classified as either a structure, process, or outcome measure. In session 3, we reviewed these 3 types of measures used to assess and compare the quality of healthcare. You will need to capture the baseline or benchmark data in order to show improvement. This can often be a challenge, identifying what is the correct data and where to find this data. Some small changes are around understanding your data in, for example, your electronic health record or in your organization's documentation. It is imperative to align your measure with your problem statement and the aim. And your main measure should be quantitative, number-based, but it is important also to collect qualitative information. The third question is what changes can be made that will result in improvement? Listed are 4 areas to explore in studying, learning, and identifying possible changes. Evidence-based changes can be derived from literature and the knowledge gained from studying similar clinical studies and outcomes. Use your own experience as a clinician or clinical support, as a community health worker, or staff in an administrative function. Your ideas, hunches, and knowledge are valuable individually and collectively in brainstorming as part of a team. Think strategically and identify changes based on priorities of the aim and on the organizational goals and mission. And to say nicely, borrow from others. Reach out to cohorts in other tribal organizations to learn from their experiences and successes in change processes and outcomes. Adapt these ideas to your specific situation. A driver diagram is a graphic of the team's ideas on what drives or contributes to the achievement of a project aim. This is a useful tool for communicating to a range of stakeholders and is central to address change ideas. When the team is in the testing phase, a driver diagram shows the relationship between the overall aim of the project, which is on the left-hand side, to the primary drivers to the right of the same. These primary drivers contribute directly to achieving the aim. To the right of the primary drivers are secondary drivers that are components of and influence the primary drivers. Secondary drivers can connect to more than one primary driver. The team then studies and records specific change ideas, or also called interventions, so that they can test for each secondary driver. As you identify each driver, you will also need to establish a way to measure it. Change ideas also can connect to more than one secondary driver. When developing your driver diagram, enlist the help of team members who are familiar with different aspects of the system under review. It's unlikely that a single individual has a clear view of an entire complex system. This is an example of a driver diagram used for the Center for Medicare and Medicaid Oral Health Initiative. Although this was executed in 2015, a few years ago, it illustrates a relevant example of how this tool was used for identifying some interventions for the aim to increase by 10 percentage points the proportion of children ages 6 through 9 enrolled in Children's Health Insurance Program for at least 90 continuous days who receive a dental sealant on a permanent molar tooth. This aim is an excellent example of a specific, measurable, achievable, relevant, and time-based goal. Root cause analysis, also called RCA, is a systematic approach to identify the underlying cause of a problem and for identifying factors that contribute to variations in performance. It is an opportunity for digging deeper and taking the time to interview and talk with your team. When one finds an unfavorable outcome in healthcare delivery, Initially, we think, was it me? That is not what quality assurance performance improvement is about. QA, PI, and the root cause analysis process are about identifying system issues that allow unfavorable variations in outcomes to occur. There are a wide range of approaches, tools, and techniques used to uncover the various contributing factors, as there is almost never a single cause. The goal is to find effective solutions that can be tested and widely implemented to prevent it from happening again. In the next few slides, we are going to look at some effective tools in developing the aims, answers, and model for improvement. We will look at the 5 whys and the cause and effect diagram. The 5 whys is a method that uses a series of questions to drill down into successive layers of a problem. Stubborn or recurrent problems are often symptoms of deeper issues. Quick fixes may seem convenient, but they often solve only the surface issues. The basic idea is that each time you ask why, the answer becomes the basis of the next why. This is a simple but powerful tool for cutting quickly through the outward symptoms of a problem to reveal its underlying causes. It's useful for problems where you don't need advanced statistics, so you don't necessarily want to use it for complex problems. Note, the 5 whys technique may not always help you to identify the root cause. This is because 5 whys can lead you to pursue a single track or a limited number of tracks of inquiry. There could be multiple causes. In cases like these, a wider ranging method such as the fishbone diagram may be more effective. The cause and effect diagram, also known as the Ishikawa diagram, popularized by Kaoru Ishikawa in the 60s, and also known as the fishbone diagram for its resemblance to the bones of a fish. This tool can help root cause analysis teams to organize and sort their ideas about problems, as well as facilitate communication across the group. A cause and effect diagram is structured and combines brainstorming and mind mapping, pushing the team to consider many aspects and causes of a problem. The problem or effect is displayed at the head or the mouth of the fish. Possible contributing causes are listed on the smaller bones under various major cause categories. A fishbone diagram can be helpful in identifying possible causes for a problem that might not otherwise be considered by directing the team to look at the categories and think of alternate causes. To summarize this session, we explored planning for the performance improvement project by looking closely at the first portion of the model for improvement. This is the questioning or thinking section, which explored approaches around setting aims, establishing measures, and selecting changes. We also looked at some tools for identifying root causes that are used for possible changes or interventions to use in the testing of performance and quality improvement. Session 5 will examine the second section in the model for improvement, which is testing changes through the use of the PDSA tool and implementing your performance improvement project. Thank you again for tuning in to session 4, and we look forward to seeing you in the next session.